I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Hello and welcome to this episode of IDD Health Matters. Our guest today is Dr. David Frey. David, welcome to the show.
Thank you, Craig. It's nice to be here.
So David, you have spent a lot of time working in the field of dentistry for people with intellectual and developmental disabilities, right?
That's true.
Tell me about it. How did you get started? Talk about your background and how you got to where you are today.
Well, the first thing I need to probably say is I'm a professor now at the University of Texas School of Dentistry in Houston. And anything I say is my opinion and doesn't represent my school.
Good
so
point.
I need to make sure that I say that. But my dad actually had 5% hearing in one ear. He had lost his hearing when he was 5 years old. So I grew up in a family with a father with disability. But if you'd asked me he had a disability, I didn't think so. I didn't even know that term.
It was normal.
Yeah. But my dad also was a pastor and he had a degree in music. He was a really unique guy. And he inspired me to want to help people. And so we had family members with intellectual disability. But not only that, when I was about 8 to 12 years old, on Sunday afternoons, he would take me to the Memphis Home of the Incurables, which was for people with intellectual disability.
So that was the name of it?
Yeah, that was the name of the place.
Wow.
And so that experience inspired me. He would take my sister and I, and he would play the piano and we would sing. He just wanted us to be around people. You know, he didn't preach at them or anything like that. He just wanted us to be there and interact with them. So I grew up in a family that was, I guess, disability friendly would be the right word. So when I went to dental school, I had a very unique experience. We had a dentist named Ike Conisberg, who was the head of community dentistry. He came from New York to Texas, and he'd been there a few years before I got to dental school. So I think he got there in 72 and I got there in 75. But he made a point of making sure that as dental students that we were educated about how to serve people with intellectual disability. Back then we used the MR term.
That's pretty rare.
It was.
Yeah.
And actually, Dr. Conisberg himself had a disability. And so I guess the long answer to your short question was my father and Ike Conisberg really impacted me. And so I graduated from dental school with a desire to connect with people with disability. Back in 1979, when I graduated, there wasn't a program you could go to learn how to be a dentist for people with disability unless you went to a pediatric dental program. But I wanted to serve adults with intellectual disability. And so in my private practice for the next 16 years, I actually sought out community providers and said, what can I do and how can I work with you? And so I think that I'm probably an anomaly in some ways, but it was mostly because of my dad.
That's pretty, it speaks pretty well to the influence that our environments have on us and what we end up doing in the field. So you've done a lot of different things in this field. I know you've worked for state developmental disability agencies, you're a professor. So talk about some of the different roles that you've had.
Well, I had been in practice for about 12 years, and I started teaching part-time at the University of Oklahoma School of Dentistry. And there was a need to teach. I taught in ethics courses. We didn't call them disability courses, but it was actually as a dentist, how do you treat patients and how do you include them in your practice? And that began to get me thinking about I could do more. So after I'd been in practice for about 14 years, I guess, I went back and got a master's in healthcare administration. And that took a couple of years, but that led me then to get involved in, to work for the state of Arkansas. And so I sold my dental practice and I went over to Arkansas and I ran the Arkansas Health Center. And I did a 1-year geriatric preceptorship in geriatric care. And as a result of that, I still have a certificate in geriatric care that led me to take board. So I'm boarded in geriatric long-term care, and I have a nursing home administrator's license. Still hang on to that.
Yeah.
But that also led me then, I did after the Arkansas Health Center, I became the director for the Children's Medical Services and the Arkansas Developmental Disabilities Division. And then after being in Arkansas for 5 years, I was fortunate enough to be recruited by the state of Hawaii. And I went to work for 14 years at the Department of Health in Hawaii. And I was the director of developmental disabilities in Hawaii and also over the hospital and community dentistry program. So I was able to combine all of healthcare for people with intellectual disability and include oral health with it in my job in Hawaii. So I really appreciated that time in Hawaii.
So what are some of the challenges that you faced in that role in particular?
Well, it's kind of interesting. When I was in Hawaii, people thought of me as the healthcare administrator.
Okay.
And I was a dentist, but the local dental community kind of didn't view me as one of them. When I came back to Texas and went to work at the dental school, then I fit in well with all the people that I knew that I'd gone to dental school with, but the disability community didn't kind of embrace me at first. So it's kind of people,
an outcast.
people that, well, you fit, you're an incast to those who are like you, right? So I think that bridging the gap between advocacy, families, state government, and dentistry is difficult. I don't know about medicine. You could probably tell me, but I did find in Hawaii, I was very fortunate in that I was able to hire a physician. Jeff Okamoto was a developmental pediatrician. I got him to be my medical director, and then he hired me over at the University of Hawaii School of Medicine. So I was actually held a faculty appointment over there, and I think in Hawaii, it really helped me kind of bridge those gaps. But when I got to Texas, I kind of went back into that mode of teaching in a dental school. Now, though, that I've been there 9 years, I have a faculty appointment at Baylor College of Medicine, and I teach there, and I teach over at University of Texas McGovern School of Medicine has a LIN program, Leadership in Education in Neurodevelopmental Disability. So I've been LIN faculty in Texas, I guess about 7 years, and prior to that, I was LIN faculty in Hawaii. Well, I really like LIN because it's interdisciplinary and collaborative, and I think for families, they don't need silos of care. They need interdisciplinary care that communicates. And I think that's probably the biggest challenge we have as healthcare administrators and healthcare providers is how do we connect to government, because government drives policy, and that's how we make sure that people get good health care.
So I'm sure there were some highlights that you've seen over the years. Care to mention one or two of them?
Yeah, I had a very fortunate career. It's kind of nothing I planned. Back in the late 80s and early 90s, I was asked to go to Honduras, and I still had my dental practice. And so I went down there thinking that I was going to do some dentistry and feel good about myself, and probably for all the wrong reasons. But it actually transformed me, because I got connected down there to two organizations, the dental school in Tegucigalpa, and they let me do lectures to dental students, which was a good experience. They got me introduced to education. But the other was I connected up to the United Nations, to the World Health Organization, and they were doing refugee relief back then. There was a war going on in Nicaragua, and so I got involved in refugee relief all the way back in the 80s and early 90s. And then later on, I got invited to go over to Romania, which was the place where we would get together and get all the refugee aid relief that went into Bosnia. And so I worked for about 5 or 6 years while I was still in private practice, taking time and going and doing refugee aid relief. And it exposed me to people who were traumatized by war, and it opened my eyes to the fact that we have a global responsibility as health professionals. And so now Seth Keller and I work with ADMD on some global health initiatives. And when I was in Hawaii, I got recruited by the World Health Organization. That came from that group, and originally from Honduras, and they asked me to go teach in China.
Wow.
So in 2010, I got, as a chief for developmental disabilities, I got to take some of my staff, and we went to China and went to Shandong University. And that was because China had signed the United Nations Convention on the Rights of Persons with Disabilities. So we did a 1-week seminar at that university. And as a result of that, I met Dr. Petrini, who was the dean of a school of nursing in Wuhan, University of Wuhan.
Wow.
And she invited me there, and we started working with them and did a family training center. And actually, she sent some of her nurses from Wuhan to our ADMD meeting. And this is probably 6 or maybe 8 or 9 years ago. And I guess it's kind of how one thing leads to another. And I didn't plan an international career, but when you view people as needing we need to be servants. We don't need to fix people. We need to serve them. And we need to try to figure out ways that we can listen to the voice of the person with disability and be very person-centered. And what I think is that I've learned in my career is that globally, families are needing the same thing. They need encouragement, they need information, and they need compassionate care. And I think those things have been the hallmark, at least of my career now that I'm at the end of my career and I'm teaching. I'm kind of trying to pass that torch to a younger generation of healthcare professionals.
So you mentioned the AADMD. Tell everybody what that organization is. We're actually coming to you from the from the conference.
Should not
here
assume
this
that.
year.
Right. The American Academy of Developmental Medicine and Dentistry started in 2002. Special Olympics held the International Games in Alaska. And David Satcher, who was a Surgeon General, was invited to come out there as a keynote speaker. And a group of physicians and dentists that were volunteers in Special Olympics said, we'd like to meet with you and talk to you about health disparity for adults with intellectual disability. He was very helpful and encouraging, but he actually challenged the group. And he said, do you guys work together? Well, you should. And you need to organize. And so that was the beginning of the AADMD, the American Academy of Developmental Medical and Medicine and Dentistry.
And you were president.
No, not then.
No, not then.
Yeah.
But you, at some point.
In
later.
2016, I think I was president for a couple of years of AADMD.
Yeah. Yeah. And the organization is thriving, moving forward, and really focusing on
it's really grown and
educating clinicians.
I think we have a niche project which stands for National Inclusive Curriculum and Health Education. And I would like to thank the Delta Dental Foundation, which actually paid for the niche dental curriculum that's just being rolled out at this ADMD meeting actually this weekend.
And the medical curriculum from Elevance, right?
Yeah. So it's been real helpful. Elevance has been real supportive to AADMD, and they've actually started working with me and Dr. Warner and some others in Texas, and we have a project in Texas that we're working to work with families and to introduce them into how they can improve health outcomes. So families need a lot of information, and then health providers that haven't been educated need to be educated. I think today we do a better job, but somebody that's been out of school for 15, 20 years, they kind of don't feel comfortable treating a lot of patients with intellectual disability.
So again, like I said, lots of experience, lots of interesting interactions, interesting places you've been, and you've really influenced a lot of people to provide better dental care and health care in general for people with intellectual and developmental disabilities.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, my ability is stronger than my disability. We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Esquire, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
I do something on the show called 3 in 3, 3 things in 3 minutes that you would like to share with everyone that you think can improve the world for people with intellectual and developmental disabilities. World of health, world of dental health, supports and services, just three things that you would like.
Well, one that comes to mind immediately is collaborative care. We talk a lot about interdisciplinary care. And so when you're a family and you go to one office and you go to another, you end up sometimes getting mixed messages or getting duplicate diagnoses and treatment. But if we had collaborative care, that would be where health professionals can actually communicate. And I think the very best way that that can be done is with a shared electronic health record that is designed specifically for people with intellectual disability. So that would be one thing. Mm-hmm. The other thing that I think is very important is in the field of intellectual disability is essential lifestyle planning. There was a guy named Michael Small that did this for families many years ago, and it's excellent. But I think there needs to be a lifespan health plan. And I think that is something that we should build on. And so not only should we have collaboration across disciplines, but we need to be person-centered and family-empowered. And I think that those are some of the ways that we could do that. The third thing that comes to mind for me would be one of the lessons I learned from Hawaii. And I was in Hawaii for 14 years. It actually is a different culture. I grew up primarily in Texas, Arkansas, Illinois. I got to Hawaii and I realized that the culture in Hawaii was one of welcomeness and empathy. And so they have a word in Hawaii called hanai, and it's kind of an informal adoption. And it was really interesting. I would run into people and they'd say, oh, this is my hanai son, or this is my hanai daughter. And it's the concept that you don't leave people behind, that you actually care about those who are maybe not your blood relative. And that's something that really spoke to my heart, because I think that many times in our society, as here in the United States, it's so easy to forget about folks and the community not being responsive to person across the lifespan. And so we had a situation once when I was a chief in Hawaii. I'd been there for about 12 years. I was there 14 total. But we had a situation where I was contacted by a person in New York. And this person said, you have a person in Hawaii that's lived there for 20 years and his mom just passed away. Can you find him? Well, he wasn't in our system. And I contacted the case manager. The case manager, the last that had been with us for the longest, she said, I remember that guy. We tracked him down, and he had been hanai'd 3 times. He was living successfully in the community. His family was the people that were local. He had moved to Hawaii with his dad. His dad had passed away. And it really spoke to me that when you empower families in ways that are not what we think, it's like, how do we serve the family's need? And having families control their budget in Hawaii was powerful. But the other thing was just the culture of Hawaii that said, we're going to make sure as a community we support this individual to live a life of inclusiveness and independence. And the aloha is a word they use in Hawaii that means hello and goodbye and love. Mm-hmm. But aloha is really real in Hawaii because they do care about each other. And that, I think that was probably the third thing that fundamentally changed me as a health professional, was a recognition that you can trust families and you need to listen to the voice of self-advocates.
What great words of wisdom to end with.
Yeah, thank you very much.
Dr. Frey, thank you so much for
my
being on the show. I appreciate it.
Yeah, thank you for all the good work you do.